Kia ora, my name is Susan Reid and I work for Health Literacy NZ. Part of the work we do is to talk to health professionals about how they can use more ordinary language when they work with patients. A lot of patients in whānau we work with tell us about how health professionals use long words and jargon they just don't understand. So the purpose of this presentation is to talk about different ways you can find out what words mean. So this first slide explains to you when someone says a word you don't understand. So you're in a conversation with a health professional and it's all going along fine, and then the health professional talks to you about pustules. And so the first thing that happens is number one, you stop listening. Then number two, your brain is trying to work out what that word pustule is. And you're working out, she said pustule. Oh, is that something to do with pus? Or maybe that's what it means. Oh yes, pustule. That sort of makes sense if it means full of pus. And then four, you make a guess. You think, oh, pustules, they must have pus in them. Or you give up. You think, oh, I have no idea what that means. Number five, you start listening again. But in that time when your brain's been trying to work this all out, you've actually missed a whole lot of the conversation and probably important stuff as well. And number six is the best option, is actually you decide if you should ask what the word means. And if we look at the next slide, you will see that that's what I'm going to recommend is the best thing to do. Is you really need to ask questions as soon as you don't understand. And it stops your brain going off and doing something, and it also stops you missing out on a whole lot of good information. So you say things like, sorry, what does that word mean? Can you write it down for me, please? Excuse me, what does that mean? I haven't heard that word before. Can you explain it in words I could understand? And if, like me, and I've done this lots of times, you actually miss out and don't ask the question, then ask it later. Ring up the health professional, the nurse or someone later and say, this word, I don't understand it, or at the next appointment. So one of the problems with medical language is that almost all medical words are based on Latin and Greek. And so cardiac, as you know, means heart. So, cardiac disease means disease of the heart. And that comes from the Latin word for cardiacus and the Greek word for cardia. So very similar. And sometimes both Greek and Latin words are used, but they're actually not similar at all. So the word for kidney, the Greek word is nephros. So you might have heard someone say your kidney doctor, they might have been called a nephrologist. And then the Latin word is renus, and a person has renal disease. So just imagine how complicated that is. They can't even use one word for it. The good news is that there are some things that can help you. So if you know the beginning of a word, that can help you work out the rest of the word. Have a good guess at it. So bronchi comes from Latin and Greek words, very similar, and it means windpipe or airway. So the word bronchitis, that has to do with windpipe or airways, and in this case it means inflammation of the windpipe or airways. And then bronchodilators are medicines that open your windpipe and your airways in your lungs to help you breathe better if you've got asthma. So here are some common word beginnings. So hemo, meaning blood. So you've got hematologist, a doctor who specialises in the treatment of blood diseases and bone marrow diseases. And then you get angie, which means your blood vessel. Now an angiogram is when they take a picture of your blood vessel, and that is something that happens quite commonly to check if you've had a heart attack. Osteo means bone. So if you've got osteoarthritis, that means you've got arthritis in your bones. Cerebral means brain, so you have cerebral hemorrhage, a bleeding in your brain. And then you've got derma or dermo, meaning skin. So you have things like dermatitis, or you have dermatology, and again, that's the study of the skin. Gastro, most people know that gastro is your stomach. So you can have gastroenteritis, where you get a really bad stomach upset that makes you feel sick. And then there's two words at the end that are quite similar but mean quite different things. So hyper means higher than normal, and hypo, that O is really important, means lower than normal. So the good thing to remember is hypo and low go together. So hypertension is really high blood pressure, and hypoglycemia is when your blood sugar is low. So we talked about how word beginnings can help and word endings can help you as well. So we've seen this word ending already. Itis is a Greek word meaning inflammation. So any word that ends in itis means inflammation of that part of the body. So we've had bronchitis, inflammation of the airway or windpipe. Conjunctivitis is the inflammation of the clear part over the white of your eye. And when it gets inflamed, it often gets pink, and so it gets called pink eye. So here's some other word endings. Ectomy means a surgical operation like a hysterectomy or an appendectomy. Gram is a picture or a record, so that's angiogram. Ologist, we've talked about that, so someone who's specially trained in an area, so an oncologist who specialises in the study and treatment of cancer. A meter is used to measure something, so a thermometer. Osis is a condition or disease. So osteoporosis is a condition of your bones and often causes curvature of the spine and you lose bone density. And then tension is pressure, so you get hypertension and hypotension. If you want to look up more Greek and Latin words, then I recommend you go to Wikipedia. It's called a list of medical root suffixes and prefixes. I recommend Wikipedia because the language is quite straightforward. I've looked at other sites and the language on those sites is much more complicated. So medicines can be tricky to say as well. And it's not because they're Latin or Greek, it's just where you put the stress in the word. And usually the words are sort of chemical words. Let's look at these three medicines. So the first one you might think, okay, I could say omeprazole, but you actually say omeprazole. And the second one, you look at it and you think, oh, that's easy. I could say primidone, but you actually pronounce it primidone. And the last one, you could look at and think, oh, that's easy to pronounce quinapril, but it's quinapril. So there's two things you can do. You can talk to a community pharmacist when you pick up your medicines, and you can have a look on the Health Navigator website on the medicines part, and some of them show you how to say the actual word. So we've talked about, the words you can have for conditions, and now we're thinking about medical tests. So most people, if your doctor says you're going to have an X-ray or an ultrasound, you're like, yeah, I know what that means. But there are other tests, so like MRI, so it uses this magnetic and radio waves to give this image of what's going on in your body. And then there's a CT scan, so that's a special type of X-ray that gives a really detailed picture. And then you might be asked to have a biopsy, so that usually involves taking a sample of your cells or tissue from your body. And then you could be asked to have an oscopy. So oscopy means they use an instrument to view a part of the body. So a colonoscopy is when a tiny camera is used to check your colon, and a colposcopy is when a special microscope is used to check a woman's cervix. So there's some blood tests where they use abbreviations involving lots of letters. And it's really complicated to ask what those letters stand for. So it's easier to say, what are you actually measuring with that test? So if someone says we're going to measure your HbA1c, that's measuring the amount of sugar in your blood over the last 3 months. ALT, LFT and GGT, they measure how your liver is working. And your EGFR measures how well your kidneys are working. So this summarises what we've talked about. Listening is hard, especially if people use language that you don't understand. When you're trying to work out that new word, you stop listening. It's much better to ask questions straight away so you can follow what is being said. And I know people might worry that the doctor or nurse will think you're stupid if you don't understand a word, but actually it's about your health and about the information you need. So you need to say, I'm sorry, I don't understand. Could you write it down, please? We've talked a little bit about how Greek and Latin words form the basis of most medical words. And if you know what the beginning of a word means or the end of a word means, that can help you work out what the rest of the word means. Ask your community pharmacist how to say the names of your medicines, because they can be tricky. And if you're being asked to have tests, ask why you're having them and what they're going to measure. Kia ora.